Resting position, elbows flexed 70 degrees and forearm is supinated 10 degrees. The treatment plane is in the olecranon fossa, angled approximately 45 degrees from the long axis of the ulna. Stabilization, fixate the humerus against the treatment table. Starting with grade 2 sustained traction for initial assessment. This grade 2 sustained traction tightens the tissue. It is also used for pain management. If no pain is present, joint mobilizations are indicated. Sustained grade 1 traction used to neuromodulate pain. No stress is placed on the capsule, therefore it loosens the capsule. And grade 3 sustained traction, amplitude is large enough to place stretch on joint capsule and surrounding articular structures, therefore stretches those structures and increases range of motion. These are done for 30 seconds. Sustained distraction of the humero-ulnar joints, same thing, loose pack position, 70 degrees elbow flexion and 10 degrees supination. Fixating the humerus to the table, starting with grade 2 to modulate pain and also used to assess tightening the capsule during mobilization. Grade 1, decreased pain, loosens capsule and it is also small amplitude. And grade 3, sustained distraction, increases range of motion and stretches the capsule and is a larger amplitude. Again, these are done for 30 seconds each.
Humoradial joint. Resting position. Elbow is extended and forearm is supinated to the end of available range. The treatment plane is in the concave radial head perpendicular to the long axis of the radius. Stabilization. Fixate the humerus with one of your hands. Humoradial traction. To increase mobility of the humoradial joint. Position supine. Stabilize the patient's humerus with your superior hand and grasp around the distal radius with the fingers and be sure you are not grasping around the distal ulna. Pull on the radius distally. Grade 1 traction. Small amplitude traction is applied when no stress is placed on the capsule. It equalizes cohesive force. Grade 2. Enough distraction or glide is applied to tighten the tissues around the joint. Grade 3. A traction or glide is applied with an amplitude large enough to place stretch on the joint capsule and surrounding structures. Humoradial anterior glide. Indications. Glide at the head of the radius to increase elbow extension. Patient positioning supine. Stabilize the humerus with your hand that is on the medial side of the patient's arm. Place your other hand and your fingers on the dorsal aspect of the radial head. To move the radial head anteriorly with the palm of your hand and fingers. If stronger force is needed, realign your body and push with the base of your hand against the dorsal surface. Grade 1. Small amplitude rhythmic oscillations are performed at the beginning of the range. They are usually rapid oscillations like manual vibrations. Grade 2. Large amplitude rhythmic oscillations are performed within the range, not reaching the limit. Provide traction where possible. Grade 3. Large amplitude rhythmic oscillations are performed up to the limit of available motion and are stressed into the tissue resistance. Grade 4. Small amplitude rhythmic oscillations are performed at the limit of available motion and stretched into the tissue resistance. They are rapid oscillations like manual vibrations. Humoradial posterior glide. Hand placement the same as anterior glide. Grade 1. Small amplitude rhythmic oscillations are performed at the beginning of range. Grade 2. Large amplitude rhythmic oscillations are performed within the range, not reaching the limit. We provide traction, again, where possible. Large amplitude rhythmic oscillations are performed up to the limit of available motion and are stretched into tissue resistance.
Proximal radial ulnar joints. The resting position is the elbow is flexed at 70 degrees and the forearm is supinated at 35 degrees. The treatment plane is the radial notch of the ulna parallel to the long axis of the ulna. Stabilization is you're going to have your right hand on the proximal ulna. The indications of this is the dorsal glides to increase pronation and the volar glide to increase supination. Alright, so for the anterior glide, we're going to be doing an initial assessment, which is a grade 2, which includes large amplitude rhythmic oscillations are performed within the range, not reaching the limit. They're usually performed at 2 or 3 per second for 1 to 2 minutes. And now we're going to be doing a grade 1. Small amplitude rhythmic oscillations are performed at the beginning of the range. They're usually rapid oscillations like manual vibrations. And we're going to be doing a grade 3. And it's a large amplitude rhythmic oscillations, and they're performed up to the limit of the available motion and are stressed into the tissue resistance. They're usually performed at 2 or 3 per second for 1 to 2 minutes. And then a grade 4 is a small amplitude rhythmic oscillations. They're performed at the limit of the available range and stressed into. Alright, now we're going to be doing the posterior glide, and we're going to be doing an initial assessment at a grade 2, and that's a large rhythmic oscillation, and they're performed within the range, not reaching the limit, usually performed 2 or 3 per minute, 1 to 2 minutes, sorry. And now we're going to be doing a grade 1, and that's a small amplitude of rhythmic oscillations, and they're performed at the beginning of the range. They're rapid oscillations, more like manual vibrations. And we're going to be doing a grade 3, and they're large amplitude rhythmic oscillations performed up to the available range, available motion, and are stressed into the tissue resistance. Usually performed at 2 or 3 per second for 1 to 2 minutes. And then a grade 4 is a small amplitude rhythmic oscillation, and they're performed at the limit of the available motion and stressed into.